So people are coming in.
Yes, ma'am.
Yes.
They will join, ma'am. Okay, ma'am. Now open for everyone. 36 participants.
So Aisha can just send a message in the group asking all the participants to join as soon as possible.
Meanwhile, we can try the screen sharing with Kaushik sir, maybe, ma'am.
Okay, okay.
I can share the screen. I have an option of sharing.
Yes, sir. You can just give a try by sharing it so that
Sure.
we'll start with the attendees. Sir.
You can try it now, sir. Can you see it now? Yeah, yeah, fine, fine. Good. Yeah.
Team, should we start? Because Dr. Kaushik should have enough of time to teach us.
Yes, ma'am.
Yes, ma'am.
Yeah, because the others can keep coming, and those of you who know the participants are coming, please remind them. So we can, go ahead with Dr. Kaushik's webinar right now.
Yes,
Okay?
ma'am.
Yes, ma'am. Sure, ma'am.
Okay, ma'am. Good afternoon to all. I am Dr. Ravi Nandal on behalf of IAP India Digital Team, and today we are here with a webinar on managing spasticity and contracture in children with cerebral palsy. And today webinar is organized by IAPWC Telangana State Team. I request everyone to kindly subscribe and follow IAP social platform for upcoming webinars and advancement in field. Now I welcome our today resource person, Dr. Kanu Kaushik sir, and moderator and senior Dr. Hana Rajsekhar ma'am and Dr. Sumaira ma'am. Dr. Hana ma'am, over to you.
Yeah, good afternoon, one and all. I really thank Dr. Kaushik for being here with us and taking the session for us. Now I request my team to take over and open the session.
Good afternoon, sir. Very warm welcome to you. I hope all the participants are eagerly waiting for your session to start. And I'm very glad to welcome you here on this platform of IAPWC, sir.
Dr. Sumeria, can you speak loudly?
You are not audible.
Yeah, one second. Hello, good afternoon, sir. A very warm welcome to you, sir. Actually, I'm on the way to my office. In some time, I'll reach. I'm really sorry for the disturbance which you are getting from my end. I really welcome you, and I'm very glad that you are here with us on this IAPWC platform today here, sir. And I also request all the participants to log in as soon as possible. Dr. Aisha, please coordinate, and so please kindly start your session. Thank you so much.
Thank you, Sumaira. So let me just, Himani, we can't hear you.
Yeah.
Imani,
So-
yeah.
Yes. So let me introduce Dr. Kaushik sir first. Myself, Dr. Himani Poddar, Sub-Coordinator IAPWC Telangana State. And I'm here to introduce our speaker for today's webinar. Our webinar topic is managing spasticity and contractures in children with cerebral palsy through PIASTM. Dr. Kaushik is CEO of Kinesio Prehab Institute. He did his master's in musculoskeletal sports rehab and PG diploma in promotive and preventive healthcare. He is an international KISTM and PIASTM instructor. He is also a certified KDNT, KDCT assistant instructor and water specific therapist. Dr. Kaushik is also a Hellevik practitioner from UK. And there are more, I must say. He is certified Pediasuit therapist USA, sensory and motor aquatic therapy for special needs children USA. He is an MNRI trainee USA. As I mentioned earlier, Dr. Kaushik is CEO of KPI, that is Kinesio Prehab Institute, continuing education programs, provider for Asian countries and Kinesio Prehab clinics. He is one of the best physio mentors and physiopreneur. Above all, he is very supportive and always ready to guide us. We welcome you, Dr. Kaushik, to this webinar today.
Thank you so much, Dr. Himani, for giving such a beautiful intro. Don't want to waste time, and I would like to directly jump onto the slides because we have a lot of things to see. So today topic is like managing spasticity and contracture, which is quite difficult for everyone to manage it. And we have formed it more simplified with just giving a result on in just few seconds or few minutes, I would say. Let's explore today those things. So what does PIASTM stand for? PIASTM stand for Pediatric Instrumental Soft Tissue Mobilization. It's one of an exceptional approach to treat common pediatric and neuro condition. And we have been training this with PIASTM in multiple countries, covering up Australia, Singapore, Malaysia, Sri Lanka. As Dr. Himani, she has already given my information, details, so I don't want to go through it. I would like directly jump into the next point. So we all know what is cerebral palsy, but then let's just refresh few points on cerebral palsy. So cerebral palsy describe a group of chronic disorder that impair person ability to control body movement also as well as posture. So it's so common that it occurs in 2 to 6 of every 1,000 birth. Since I have been associated with pediatric hospital, we have two pediatric department. This is quite common for us also that we are seeing CP kids every month. We have 1 or 2 cases, which is quite common, which has become like that. Now, what are the types of cerebral palsy? I am not going to go too deep into it because everyone knows about it. So if a cerebral cortex of a brain has been damaged, it might lead to a stiff muscles called as spasticity, spastic CP. If basal ganglia has been affected, we call it as a dyskinetic movement, or it's because of uncontrollable movement. If cerebellum is affected, definitely poor balance and coordination can be seen, and that is called as a ataxic CP. If multiple places or multiple areas of the brain has been damaged, it gives you a combination of it. Now, among all these three, spastic CP is more common. Spastic CP is like 70 to 80%, which has been, if you see globally, 70 to 80% of it has been affected by spastic CP. And 6% is ataxic, miscombination is less, disconnect like less. Now, if we try to, again we branch it out, spastic comes under hemiplegic, diplegic, even quadriplegic, and sometimes even a monoplegic also. And generally what we think is how to manage all these things, how to treat it. One of the example I would like to tell you, the moment you're gonna see spastic cerebral palsy, of course, what we clinical symptoms, what we see is an increased muscle tone. And for every therapist, it's one of a challenging part, like how to manage the tone. Now, this increase in muscle tone or hypertonicity, it leads to a restricted joint mobility also, and that's how hampering global development delay of a child. I want to give you a very small example. If a child is with spastic, he's been diagnosed as spastic CP, one of the common thing which we're gonna say is a scissoring gait. If a child has been having a scissoring gait, there are a couple of things which will be associated with. So one thing is, of course, there are developmental delays, limited growth, increased risk of falling. I know a couple of people would have seen these things in your practical, maybe like, in clinical clinics, or even in your practical practice. They do have pressure sores around the knee, because since they are walking most of the time, giving pressure on the knees or around the ankle too, limiting the range of motion due to tight joint. And if they are adults, they do get a lot of pain around the tight muscles and they strain their joints. And the walking ability is already, they have lost it or it has reduced. So how do we manage it commonly? So generally what we do is we provide exercises, we provide aquatic therapy, we provide electrical modalities treatment, we do a neurodevelopment program. There are multiple therapies which goes on. In the end, when we are not able to manage, we give them splints. If splints are not enough, we go to a buttocks intervention with casting or without casting. And then is what we move into a surgical intervention. Now from surgical intervention, either we go for a PMFR called as percutaneous myofascial release, or SPML surgery, or maybe like, tendinoplasty if you want to do a tendon release and all those things. But in the later time, or in this current scenario, most of the doctors, they actually avoid tendon surgeries, or they are preferring more of a PMFR surgery, where they work on releasing a myofascia around the muscle. That is what is called as a percutaneous myofascia release technique. Now, since we have been working with exercises, electrical modalities, planes, bottom innervation, I know, the duration of treatment or the duration of recovery, we have literally extended that time frame. Now I want to ask everyone, I will, you can give me reply maybe in the end of a session, like, are you satisfied with the outcome, what you're treating, and how long have you been treating a spastic child? I know, you would say like, sir, we are treating for 2 years, 3 years, 5 years, 6 years, if you're continuing that long. So according to Physical Medicine and Rehabilitation Clinic in North America, they said that passive stretching alone is not an effective long-term improvement in muscle tightness for child with cerebral palsy. And that's true. Now most of the places, they are actually avoiding passive stretches rather than they are going for active exercises or active assisted activities to increase the length. Now, I have a surprise for you. If I tell you there is a therapy which is well developed, goal-oriented, non-surgical, and one of the fastest ways to show you results, and it's available, it is called as a PIASTM therapy. There's one of the picture, if you can see the picture, I've been actually treating kids in Philippines. It's a group of therapists over there, mixed of occupational therapists as well as pediatric physios. So what is PIASTM therapy? So pediatric instrument is soft tissue mobilization. It's a therapeutic technique where they use a specific tool called as Excel tool. Excel tool means accelerate healing on children to promote mobilization of restricted tissue. And this is used basically to increase flexibility, to increase range of motion, to reduce contractures, improve muscle activation, as well as if there is a hypertonicity, we inhibit those muscle firing rate. There is a study where they have shown that when EMG was done on the muscle, after ISTM therapy, it actually the signals improved to 500 points, and it was wonderful. And when we are using PISTM technique, we specifically use Excel tool, which was actually designed for this therapy itself. Now, I'm not going to waste more time on talking about theory. I would like to take you for the picturization. So let pictures speak more than me. This is basically a adductor release. Let's go to next one. So this is a hamstring release which we had done on a child who has been diagnosed with as a spastic CP. This was done in a Mumbai hospital name is SRCC, which is a proper children hospital, and this results is on spot. This was deformities present in lower limb in spastic CP child. The surgeon had advised for a surgery. They had consulted me on in Malaysia in Kuala Lumpur. Can you see the range for the pre-PIASTM and the post-PIASTM? It's just one session. I'm just showing you the results in pre and post, which is just in one session. This is in Australia. This girl is somewhere around 9 years old. I was in Sydney, and she had a literally hamstring tightness. And you can see, like, even if I'm pressing down on the first picture, both knees are actually in. She cannot make her legs straight even with the passive movement. Now we did a left side first. We did a PIASTM on the left side, and then is what we did on the right side, PIASTM therapy. Now, if you can see the elongation, muscle elongation, you can see it's so nicely, it has been elongated. And this just took, it's on spot. The results are on spot. This was a case of torticollis. Again, it was in Malaysia. So you can see the difference between before and after. So we use this PIASTM therapy in CP even with torticollis condition. This was a 2-year-old spastic child which we were treated in Spasticity, which is again a Philippine. So if you can see a spastic child with a knee hamstring tightness, and you can see in another picture. It's just pre and post picture. This is again, it was in Australia, like you can see the bicep muscle tightness, and then in the next picture, it just moves, the range increases on spot. This child is from Dubai, calf muscle, if you can see calf muscle tightness, ankle range has been not even completing 90 degree. And the range, the post range, you can see it's more than that. Same thing goes with the hamstring release. So we have done a hamstring release as well as for the calf muscle release also. The other picture is from Australia. This child was actually supposed to go for a surgery. And doctor has advised that he can never, like his legs, we can never become straight. You can see the spot. And the surgeon, Australian surgeon, was surprised, like, how come this is like, how we are able to achieve it. This was beautiful result. The second picture is in Chennai, where, of course, there was a quadriceps, hamstring muscle tightness was there. It was a spastic CP child. And then is what we have activated quadriceps muscles also. So you can see the range where actively participating in doing a knee extension, the range was limited. But the post PIASTM, you can see the increase in range and it's on spot. Just treatment is of 2 minutes. So all the above results are just in one session. Duration spent on each muscle was hardly 2 to 4 minutes. 4 minutes is the max is what we spend. We generally finish our protocol in just 2 minutes. Now you must be wondering, like, how is this possible? Is it really possible or not? Was it painful? Most of the parents have asked us, like, is it painful? And how many sessions to achieve this result? And how frequently we can do this? So yes, my answer is this is possible. It is done on spot. It's not painful at all, because this is not PIASTM. What we have a concept of using PIASTM. PIASTM is completely different than PIASTM. PIASTM is, of course, I'll be explaining you later, like, how different it is. But yes, it's different. How many sessions to achieve this result? The results was on spot. So we haven't done any exercises. We have just done PIASTM therapy and we got this. But then yes, PIASTM is not a standalone therapy. We make sure that after PIASTM sessions, we are including our specific therapies or exercises according to the child need. Now, how frequently we can do is, we definitely do it, like for spastic condition, we do more number of sessions. And for hypotonicity, like where the muscle tone is less, we do less number of sessions. If you ask me what all major physiological system has been affected by PIASTM, or where all we working. So I would like to tell you that we work from a level of skin level. We are working on the nervous system. We are working on the fascia, muscles. Joints is indirectly because the tool cannot reach to a joint. And circulatory and lymphatic drainage system, it works pretty well. If you ask me why skin, what is the role of a skin? So I'll tell you, like, skin have mechanoreceptors. We work on tactile dysfunction. If we are working on autistic children, I'm not sure how many of you are working with autism or autistic children, but then this PIASTM therapy, it works for tactile dysfunction and gives you amazing result, desynthesizing the hypersensitivity of a skin. Nervous system is where we try to activate muscles or soft tissues, or if we want to inhibit the muscles which are firing rate, where the firing rate is very high. Fascia is a everyone is talking about, and like fascia is one of a favorite part of for me, where we make sure that we are working on fascia. I'd like to tell you what exactly we are doing in the fascia. So everyone knows about fascia. Fascia is a band or a sheet of a connective tissue which actually cover everything from your muscle fibril, from muscle bundle, it's separate like a compartment, it covering your visceral organs. So if your fascia has tight, trust me, your movement's gonna restrict for sure. So what we do is we enhance mobility of a fascia, which helps in increasing range. Your patient feel better. It's a very common or a very simple way I would like to explain you this. The second point is what we work on a biointensigrity. Now, this term biointensigrity was actually coined by a non-physiotherapist called as R. Buckminster Fuller in his 40s. And this points, like, the highest, like the clinical point, what it work on the mobility, stability, and function. So I would like to give you a very simple example. For example, a child with hamstring muscle tightness, and so hamstring muscles are tight and the range has been reduced because of that. But have you ever noticed that his quadriceps muscles are actually getting overstretched and they're going for weakness also? So when with the help of a tool, what we do is we increase range in uh, hamstring muscles, but then we actively activate the quadriceps muscles, which help in improving that strength, and that's how we get a good range, and that the child is able to stabilize also pretty much with that. Increased fibroblast. This is one of our principles what we use. So increased fibroblast recruitment. Fibroblast, in a common term, I will tell you, this helps in healing. So there was a study done on a fibroid by Jelson et al. In 1999. So where they have shown when you are using an ISTM to increase fibroblast proliferation and to promote collagen repair. So they did a test on the rats. So what they did was they actually it was called as an enzyme-induced tendinitis on a rat. With the help of a ISTM therapy, they actually showed that healing is getting improved. So PIASTM therapy also works on the same phenomena, which actually helps in increasing fibrotic recruitment and helps in healing. So most of the children where you give a lot of stretches, generally you are actually causing sometimes you're damaging these fibers also, because you're breaking those muscle fibers, and that forms kind of a knot. Not that these knots are different than trigger points. So what we do is we have a process called remodeling and repair system, where we use this blast recruitment, which helps in actually giving us a good range. Mechanoreceptors. So as I told you, we work on the skin as well as skin level and a muscular level. Now these mechanoreceptors are nothing but receptors which get activated with any kind of a mechanical stimulation. These receptors actually work for maintaining your muscle tone. So when you're gonna stimulate these mechanoreceptors, your tone, you can actually regulate the tone. Studies has been done on this also, and they have proved that a very simple example I'd like to tell you. If you go for a spa, if somebody is massaging you, why you feel more relaxed? It's just because of mechanoreceptors. But then yes, we are stimulating mechanoreceptors with the help of tool. It gives much more better approach, and yes, it works much more better than a massage. Neurophysiological effects. So there was a, yes, still ISTM over ISTM, PISTM, or whatever you think about related to ISTM, there are very less scientific evidence till date. Every year, some of the people, they are doing research, they are bringing evidences. So for neurophysiological effects, there was a study done by Cottingham. They said, like, as any kind of a soft tissue mobilization with an instrument may stimulate sensory receptors within the facial fibers. The moment you're gonna work on this receptor, you can either activate muscle fiber or you can inhibit the muscles, high tone muscle. PIASTM therapy cycle. So for example, a child with hypertonic muscles, or if a child comes with a pain or with a restriction, now this PIASTM actually therapy is actually inducing an inflammatory response. The moment we induce an inflammatory response, this fibrotic tissue and like fibrotic cells, they actually start sending a collagen fiber, which getting a remodeling the tissue structure and helps in tissue healing. Once this tissue healing process is happening, we put them on exercises, specific exercise according to our goal, what we want to achieve. The moment you put on exercises, of course, there is a improved tissue quality, better alignment of a collagen fiber. Pain is reduced, as well as their range is increased with the help of a PIASTM. So this is called as a PIASTM therapy cycle, which we always focus that we're working on these segments. What kind of a documentation, if you're providing PIASTM, what kind of a documentation are you taking? Of course, the most common documentation in what we start is the subjective and objective way. You are taking all the data of a pediatric condition. Along with that, if a child is having kind of a pain, so we are taking a various pain scale. Now, going to the range of motion is something which I always make sure that we are opting for that, because then is what you know how much range you have achieved, what was the lag and active range he has achieved with PIASTM, and what is the passive range what he has achieved after PIASTM. We do take lower extremity functions scale. In couple of our programs, we have included GMFS score also, and that's, yes, we use DASH scale also. This is all documentation, but then these documentation work on, it's not same on every child. It's going to be different on every child, depending on what your goals or what the area what you're treating, depending on that. It's a very generalized thing what I'm giving an idea. So the benefits of PIASTM therapy is, of course, it's helping you to improve nerve conduction. It actually improves your proprioception level because of improving their sensory, you're stimulating their sensory bodies. It actually helps in improving your fluid circulation, because the moment you're going to work on the mechanoreceptors and the fibroblast recruitment, it actually helps in circulation too. Tissue healing and repair system, managing your muscle tone. The moment you're managing your muscle tone, you definitely get a good range, the flexibility improves, and end of the day, a child get a good functionality and a good balance with this. So there were a couple of studies which was researches. There are only very few studies which was done. So there was AISTM therapy improves bilateral hamstring flexibility and Achilles tendinopathy in a child with cerebral. It was a retrospective case. So in this, what they have done is they have taken a sample, like a girl with 8-year-old CP child, where they have used AISTM therapy on bilateral hamstring. Basically, they wanted to increase the range. Now, when they started giving, what they have given almost like 11th session, along with some exercises, home-based exercises. The result which they have seen was they could actually achieve a good range, a good flexibility, as well as strength. In this case, now, there was another study where they have used the effect of PIASTM therapy on a child with spastic diplegic cerebral palsy. Now, in this study, they have given same thing. It's again a same. They have taken one female child, 6-year-old. They have given treatment for 9 months. Yes, the duration of this therapy, according to them, was like it's more. We generally don't do PIASTM therapy for 9 months. That also in 9 months, 36 sessions, we don't do it. We do have a weaning out phase when we give PIASTM therapy. Like we start with 4 to 5 sessions for a week in starting, and then we start weaning out, like maybe like twice a week, then in like 15 days once, and then monthly once. So we wean out also from this therapy. we don't get dependent completely on this therapy. So in this research, even they could actually see that yes, the therapy had given them a good range, flexibility was improved in a child. There are a couple of references. If you want a screenshot of it, you can take a screenshot, or if you want, I can share you later. So there are good references where you can actually go about it to know that, okay, where ISTM therapy are actually helping these children or in adults too. Now, one thing as a therapist, what we do a mistake is in a market, we have multiple sets of tools. Everyone is trying to sell anything and everything, but this is not true. Not all tools have the same efficacy. You should know that is the tool really going to work on a child or not, because not every tool is designed to work on pediatric condition. There's a huge difference when you're working from a regular tool or from an Excel tool. So if your efforts are good and if you're using a wrong tool, you're not going to get result with this. So there is something called as a how to select a tool is what we make sure that we make you understand that even if in a market some tools are there, how you can select the tool, is it really going to worth it or not? So among everything, I've been training therapists from past, I think 7-8 years, and we have changed our tool because we were always doing research. So these tools are designed with one of my team in Canada, and the tool name is Excel tool. One of the most advanced tool because this single tool can be used even in adults as well as in pediatric condition. It has benefit is like, single tool can be used in all your anatomical surfaces. You can start working from your fingers and from your SCM muscle to the larger muscles like lats or thoracolumbar fascia, anything and everything. But I'll tell you one thing, you cannot reach to deeper tissues or deeper muscles with the help of a tool. If you understand the cross section of your body, tool will work only on your superficial area. You cannot reach the pressure to a deeper tissue. Another thing is we do work on diaphragm area, but this tool or any other tool will not give any kind of a response when you're gliding it on any organ of your abdominal cavity. So make sure when you're using any kind of a tool, you're using it very safely. And this is what you must have seen very commonly on YouTube, your pictures, people doing ISTM, and they show the this kind of a micro trauma. I call it as a micro trauma or bruising. We are not into this. PIASTM is not into bruising. Actually, this therapy was not our therapy basically, but then general ISTM was originated from China, which used to call as a gua sha technique. Now, gua sha technique is something they have a different concept. For them, it was like bringing out all negative energy. So what they used to do was they literally used to scrape your back or the treatment area. They even till date, you have gua sha spa in many South Asian countries. Even if you go to Singapore, you have a gua sha spa. Even if you go to Malaysia, you will have a gua sha spa. So gua sha therapy, they use tool because of course they have, this therapy has been originated from them. But then ISTM, then there is a therapy called KISTM and the PISTM. So KISTM and PISTM is not into this kind of a bruising. So you will never see bruises, this kind of a bruises on any kind of a pediatric condition. And this is what makes us different because our protocols are completely different. Because if you're going to do something like this, you're going to form more collagen fiber. They might get more stiffness and it will be more painful. They might get fever also. So as I told you before, that PIASTM therapy is not a standalone therapy, but definitely work like a catalyst. So if you have seen those pictures, the range what you were trying to achieve in months of stretches, I'm trying to give you range in just 1 or 2 sessions. Now, if you get a range in 1 or 2 sessions, you are jumping directly to the next step of balancing them or giving them other opportunities to explore with. So yes, it worked like a catalyst in your rehabilitation therapy. The achievements, what in course of time when we were training, what are the achievement what we have achieved? So This was like fourth annual Sarawak rehabilitation update in Malaysia. This was organized by what is it? These are rehab physicians. Rehab physician are those people, of course, and with the neurologist also. Rehab physician are the people who actually do their MBBS, and after MBBS is what they do a rehab physician. And they are the people in Malaysia who guide physiotherapists and occupational therapists like what exercises has to be done. So they had actually asked us to come down and to present a documentation, as well as to present case on PIASTM therapy. And it was a wonderful conference because we were only 3 speakers, 2 from India, like me and one of my friend who is standing close to me. His name is Savana. He's a very specialized orthotist. So we both were we were representing India, and one of a neurologist, she was from Singapore, and it was really wonderful spending time over there, explaining them how PSM has been changing life of children. Yes, we have been training visually impaired physiotherapists also with this technique. So they are providing wonderful results. So this picture is in Philippines, where one of a very well-known hospital called as a MedMom hospital. MedMom has almost like 30 PTs, like there are 30 therapists, which has like strength of like maybe I would say like 20 PTs and 10 OTs, and they all got trained by us. MedMom said like they wanted to give one of the best thing to their participant or to the children who are coming over there, and we were able to train almost like 30 people over there. This is how they celebrate Halloween with our tool. So yes, we have been training globally, like Australia, Singapore, Malaysia, and in Malaysia we have been training almost like 6 years. So many therapists are available globally, and they have been helping children. One of the feedback I would like to share you, this is the recent, I would say, not an Indian review of feedback. This was this is a case of a child. We were there in Australia 2000, like last year in March. So I would just like to read this. Thank you, Dr. Kanukoshik, for helping Max this week. I'm blown away. For those of you who don't know Max personally, all these positions were not achievable last week. He's flexible now is insane. His stand position without F4 prior was tippy, like he was on a tiptoe with the crouched at the knees and little hunched. Now, if you see, he's actually able to stand straight. Mother has actually given this feedback. She has been trying therapy from the time when this boy has been born. And if you see today, just like the picture what I'm showing you, it's in last year March, you can see him standing straight. Now we took a feedback from this Max also, and Max said like, sir, I'm feeling completely light and free. This is this kind of a feedback every child gives. Like just day before yesterday, one of our therapists from Belgium, they have given this therapy to one of their patient, and the child is 6-year-old, and he said, sir, I'm feeling very light. My range has been improved. I'm able to lift my shoulder so easily. And mother was so surprised. She asked my therapist, like, how is this possible? We have been doing physiotherapy from ages. Until date, my son has never told me like this. So this is how a child feels. They feel very free. They feel very light. So we do have a PISM clinic. We organize PISM clinic in multiple countries. This is what we do, like Australia. Like if you see from the left side, second lower picture, we had a patient from Pakistan because they couldn't come to India. But then she actually took a therapy with us in Pakistan. She actually come down over there, and yeah, it was a good time. So we have been covering many countries with that. So we do provide on-site programs, multiple places. We have certified PISM clinics. One of the important message what I'd like to tell you is the therapy looks really easy. Like if you're watching on YouTube with us, we actually don't share on YouTube. But if you see us handling this patient, it looks really easy, but then trust me, it doesn't work out so well. These therapists who have been trained, they have certain hour to practice, and it takes a couple of hours or maybe like a couple of months to become perfect using a tool. The moment if you're using a tool wrongly, you're going to give more bruises and you're going to increase the spasticity of a child. So please, if you are not a PIASTM practitioner, please don't use ISTM or no matter what therapy or with a tool on these children. You might actually, give them a more micro trauma than, you will be having them. So we do have a channel partner or authorized centers in Malaysia, Indonesia, Philippines. Like in India itself, we have multiple places, and in Australia, we have been providing the same therapy in Sydney and Italy. They have been an authorized center by us. So just a picture of what we have been doing in Malaysia. These are, oh yeah, like, we have been teaching, we have taught this in SRCC hospital from Bombay as well as Safi hospital of Bombay. I was very happy when Safi hospital HOD sir, he actually gave this opportunity and he wanted to give one of the best treatment to the children who are coming over there. So yes, so if you are on social media, you can just use hashtag PIASTM to know the details about. We have multiple videos where even if Australian physios have mentioned that they were very happy to get a therapist from India to train them, and the results were amazing over there. So if you want to become a PIASTM practitioner, you can just log on to planicipyapp.com or you can contact us. I think so, Dr. Himani or Dr. Hannah ma'am, she will be happy to help you out if something is required. So yes, thank you for listening. I know we are in the end of something. I know we cannot go back to the, we cannot go back and we cannot start new beginning. But then definitely if we really want to achieve something, we can bring a good ending to something else. So if you have any questions and answers related to today's thing, you can ask me.
Yeah, good afternoon, sir. Thank you for the session. Thank you so much. It was a wonderful session, and I hope the participants got to know a lot about PIASTM, and many of them might have heard it for the first time. I request the participants to ask for questions if they have any. Participants, kindly unmute and ask your question, sir.
Yeah, I have one question from one of my staff. Come here.
Yes, ma'am.
Yeah. In fact, I was just discussing with her about this. So I want her to
I was
come
not
here.
asked, ma'am.
Good afternoon, sir. Sir, I
Yes,
just
ma'am.
have one small doubt. Like
Yes.
we are saying pre and post, there is an increase in range of motion.
True.
So does this increased range of motion continue the next day or
So,
like will it
yeah,
like
I'll tell you. It's a very good question, and most of the therapists as well as parents they do ask us. So I would like to clear it that yes, the range what achieved it's for a short duration. 10% actually falls back. So 10%. Why I'll tell you is because we are increasing a fibroblast recruitment, automatically healing starts again. So whatever the range what you have achieved, like next day you will feel that oh yeah, 10% is falling back. Now as I told you, this standalone therapy, you will be working on ranges also. So whatever the range what we have achieved, we are giving them couple of exercises or maybe orthotic or braces to maintain it.
Okay.
And that's how we are able to sustain it for a longer time. It's a very simple thing. For example, I do yoga for 1 month and I stop. After 2 months, if I'm not doing it, I'll go back to my original state, what I used to be. So it's a very simple, like I cannot say that it's going to be, completely permanent what they're achieving. It is a temporary solution. But then, yes, faster than anything else.
Yeah. Yes, sir. Thank you, sir.
And faster than anything else, and also commitment from the family to maintain the range.
Yes.
Because the
Sorry,
exercises,
I didn't get you, ma'am. Sorry, I didn't get you.
commitment from the family also to work on the child
Yes, ma'am.
to maintain that range.
Yes, ma'am. So we make sure, ma'am, like either we are using orthotic devices or we train parents for a couple of exercises, or we do have we have wonderful therapists. Like every therapist is wonderful. So what they do is they actually keep doing follow up, able to maintain it. And these children they don't have to come every day to a therapist. They can take so in starting is what they need 3 to 4 sessions. 3 to 4 sessions we are able to maintain that like we get a range we give them back they can actually maintain with some exercises once they see that yes range is actually becoming stiff they come back to us and there is something called as a growth spurt so at the age of 2, 4, 6, 8, 10, 12, till they reach 14. These children will require this therapy because the moment they grow up, their height increases, muscle like length of a muscle doesn't increase according to the bone, and that's how the tightness sometimes increases at this particular age group. So we work during at that period also.
Thank you, sir.
Yeah.
There are some more
Any
questions,
other-
I think.
Sorry.
Any other questions from participants?
There are in the chat box.
Okay, so there is somebody has been mentioned that can we see a demonstration of a procedure? It's quite difficult to show you the demonstration of this procedure because we need a child. Otherwise, I would have definitely shown you. And second is, so is this treatment approved to be a part of training for PTs? Why not? Why it isn't? Like, if something which is giving you a result, why not? We have been doing it from pretty long time. And moreover, like, it's not like just a physio, even rehab physicians from Malaysia, MARC, Malaysian Association of Rehab Physicians, they are doing this. They are doing it in a government hospital over there. I was very happy to, that they have started taking that in at least a government setup. And the government setup is beautiful.
Even I have a doubt, no? Like,
Yes, please.
while discussing, you said about autistic children.
Yes.
You said we have some kind of therapy even for them. We use some tactile measures. Can you just explain?
Very small example I would like to give you about autistic children. Autistic children definitely develop classical feature is walking on toes. Now, walking on toes is basically a sensory issues what they develop. The moment they keep walking on toes for a longer duration, they will develop hamstring tightness as well as calf muscle tightness. Now, what we do is we have a protocol of desynthesizing hypersensitivity. We use that protocol along with calf muscle release as well as hamstring activation of is anterior activation of quadriceps muscle. So there is a proper protocol which we follow over that, and it gives really good result. Now, this is just a one part of autism. Like, we are just helping occupational therapists. So occupational therapists are the people who actually work more on a sensory integration. We are just a small part of them. We are supporting them in their therapy. So OT and PT are working together and giving a good results. Yes.
I too have a question, sir.
Yes, please, Himani.
So, is there any set protocol as in terms of number of sessions? Like, as you said, the effect is seen in very first session. So, is
Correct.
there some maximum or minimum number of sessions, or where is the limit?
Yeah. So, Dr. Himani, like, there is no fixed protocol because every child gonna show because every child specifically gonna be different. The level of brain damage is different. Now, what happens is if I'm getting almost like 60-70% result on first day, to maintain it, it will take another 2 sessions, and of course there will be improvement over there. Now, for a week, what we do is we give them 4 to 5 sessions in a week, and next week we put them on exercises, maybe like you can say alternate session of PIASTM along with exercises. And now we start maintaining. So, for example, I know I can achieve complete range. We are once we achieve maximum range, we maintain it. Now, the moment we feel that no, the spasticity is increasing or the tightness is coming back or contractures are again, the child is developing contractures, we start working on reducing it again. So we following up with every patient of ours. So it's a kind of a database what we are maintaining.
Okay. Thank you, sir.
Any other questions? So shall we close the session, ma'am? Hannah, ma'am, shall we close the session? I think you need to unmute, ma'am. Your mic is off.
If there are no questions, then
Yeah. Okay. Okay, ma'am. I request Dr. Monima to kindly give vote of thanks, and then we can end the session.
Thank you, Sumeria, for giving me the honor of proposing the vote of thanks for today. Firstly, I thank today's speaker, Dr. Kanu Kaushik sir, for readily accepting our request and sharing his expertise on the Excel tool and pediatric instrument aided soft tissue manipulation and mobilization technique in CP children. I extend my sincere gratitude to Dr. Sanjeev Jha sir and Dr. Ruchi Vashne ma'am for facilitating and providing this wonderful platform. I also thank Dr. Ravi and IAPWC events team and digital team for facilitating and supporting this session. I am also thankful to our state team for the coordinated teamwork. On behalf of TS IAPWC, I appreciate all the participants who have joined us today to benefit from this session. Thank you and have a good evening.
Thank you, Dr. Mahima.
Thank you, Dr. Kanu.
Thank you, Dr.
Kaushik, it was
Ma'am.
really informative.
Yeah, no, it was really nice meeting you, ma'am. And thank you, Dr. Imani and your whole team, IAP team, for giving us chance for this platform. We could show that, okay, like how PIASTM can be helpful in your regular practice. Yeah.
So actually, this is a very short session where we need to learn more from you. I think we will look forward for your sessions more on different modules as well, because you are expertise and in pediatric practice. So I think we'll again get back to you for some more sessions with you.
Sure, ma'am.
Thank you, sir.
Thank you so much, ma'am.
We really
Thank you so
glad
much.
to have some sessions on PIASTM on the techniques and in detail in future.